Regarding the special teams Mr. Dubé sent to CHSLDs, Dr. Nguyen, you remember him? He was part of this special committee on CHSLDs. He says the province needs to do better, like a better job at identifying the homes, seniors' homes that are vulnerable and need better infection control. And when you intervene with 60 to 70% of infections, and that's the case for the 3 CHSLDs, so when you intervene with 50 to 70% infections in homes, it's too late.
No. Well, I appreciate the question because first, there are 2 levels of intervention. The first intervention is we're being made aware by the responsible the day of the eclosion. That's the rule. So, and then the team that is responsible for protection of infection act locally. So that's the first thing. And I've checked this morning, it is what's done. Okay. The second thing is we have within the establishment, within the CIS or CIUS, a team that is accessible to that CHSLD in particular. So they have intervened at the beginning of the problem, okay? What we do when we send the team from, can I say, the provincial arrangement, that this is to make sure that they're doing everything that should be done. Okay, so it's not that we wait until the progression is there. So that's the reason in those cases, because the number are important, that I said I want to make sure that the intervention that has been made locally is being done properly. That's exactly what we do. So we don't wait for the big numbers. I'm just saying there are 2 or 3 levels of intervention, and this is what I'm going to see in the next few days. Have we reacted properly as supposed to be?
And Mr. Dubé, I'd like to go back to the issue of the growing number of outbreaks in seniors' residence and CHSLD. Can we explain in simple terms why it's growing again? Haven't we learned anything from the first wave? Why aren't these people better protected this time around?
Well, I think they're a lot better protected. I'll give you a statistic that to me is clear. At the same time, at the first wave, say 50 days, because that's the number that is representative of the situation, we had roughly 100 outbreaks and 2,700 people were affected after 50 days. Today, after 50 days of the first wave, and this is a statistic that we will monitor in the next few days, few weeks, we have, I wouldn't say only, because it's always too much, but we are at roughly 320, and I try to remember, so 320 compared to 2,700, so it's almost 9 times less, 87% less of people affected comparing to the first wave. Is it perfect? I would like this to be 0, but in a virus that is so difficult to control, I think we've done a good job so far, because you can see that out of the 40 CHSLD that are affected, only 4 are in the red zone, what we call. And when we had outbreaks in the 36 other, we have been able to control them because the local team and the regional team have been involved to make sure that we control those outbreaks. So to me, I think we're better protected. Is it perfect? No, we still have people that die from it. We don't like it, but I think if you compare the 2 waves, I think we're in better control. And this is thanks to the PCI, the prevention and control measures, thanks to the employees that are doing a good job, even though they are tired. But I think this is a very different situation. But we should not let the guard, because the virus is at the doors of those places.